Policy series for Kautilya School of Public Policy. Happy to be associated with them. I'm Smita Sharma, and we have our students and other people also tuning in for a very important conversation this evening, because I think the world, India included, of course, has just started to emerge out of the pandemic. The pandemic is not over. It's not even been downgraded to an endemic in India. And, amid all of this, of course, there are so many new challenges that globally we have been exposed to because of COVID-19, and not just in communicable, but in non-communicable diseases too. So we thought that why not get a panel of experts to take a look at what are really the big lessons learned from the pandemic on two fronts. One, on the individual health issue itself, because that's something that I think all of us have either been traumatized with or been obsessed about. And in the broader healthcare, medical care perspective, when it comes to bridging the gap between the public sector and the private sector, how do you go about it? So I'm very happy to have an eminent panel with me here. Let me start by introducing them. Dr. Amrish Mittal, he's a chairman in endocrinology and diabetes at Max Healthcare, somebody who's also a very, very warm and a genuine human being. Professor Dr. Arvind Kumar, unfortunately Chairman, Institute of Chest Surgery and co-chairman, Institute of Robotic Surgery at Medanta Healthcare, was supposed to be with us. I've been told that he's scrubbing in for an emergency surgery of a child. I'm wishing him all the best. In case if he comes out, he will join us at some point. I also have with me Ramji Srinivasan, somebody I consider a dear friend too. He's the founder director for Sports Dynamics, but he has been the former strength and conditioning coach for the World Cup winning Indian cricket team. He has also been the SNC coach for some of the IPL teams, including Mumbai Indians and Chennai Super Kings. And of course, now he's into a wide array of promoting good sporting talent in the country too. And last but not the least, I have Dr. Nalini Saligram. She's joining us from the United States. So she is the founder and CEO of Arogya World, that also works a lot on sustainable options, on how to go about non-communicable diseases too. And she's also an Ashoka Fellow. So thank you so much for each of you. For all our audiences, we will be monitoring. This is being live streamed on all our platforms. Any of you who has a question, please feel free to drop in a word, drop in a question on chat boxes of either of the platforms, and our colleagues will help collect those questions, and I will put them out for our impact panelists as well. But let me start by asking you, Dr. Amrish Mittal, and before I talk about the broader health policy on the individual level today, what did COVID change about your own lifestyle? And really, today when you look at, there is so much that is talked about the long COVID impact. We have had 3 waves, different variants, including a Delta, an Omicron. What really are the sort of red flags for people today, individuals today, to watch out for?
Thank you, Smita, for having me here. I think we've learned lots of lessons, and it's like sometimes the blind man and the elephant. We only look at what we've learned, but actually the larger picture is pretty impressive as to how we can gain, by our learnings from this devastating pandemic. So let me first clarify, and I'm so glad you mentioned it, that basically a pandemic is a viral infection. In this case, was a viral infection that spread across the world, and it affected millions of people and killed hundreds of thousands of them. The issue is that we tend to think of a viral infection as an infectious disease, and we put it in a silo of infectious disease or communicable disease versus non-communicable disease, right? Whereas actually this pandemic proved that it's actually a syndemic, sin as in SYN. It's two pandemics or 2 epidemics coming together, because consistently across the world, data showed that people who had underlying non-communicable chronic disorders like diabetes, hypertension, heart disease, kidney disease fared much more poorly than populations where these factors were absent. So therefore, in our own data, and we're not going to go into data today, but basically the outcome was 2 to 4 times poorer in people who had diabetes, for example. That's easy for me because that's my field directly. So it's important to understand that if you have a population like Delhi, for example, has at the age of 60, which is also the population that got most impacted by the pandemic. At the age of 60, almost 35 to 40% people have diabetes. 35 to 40%. Now, and you can see the mortality and whatever happened with COVID. Now, if this percentage was 5%, for example, we would have had much less impact of the pandemic. So when we are talking of controlling pandemic impact, one is, of course, everything that has been done, the vaccines and all the infectious disease stuff. But if the population at baseline is healthier, even a very bad raging pandemic will have less impact. Ultimately, we are looking at impact on morbidity and mortality, right? So therefore, both at the personal level, everyone, instead of popping a million pills, which do nothing, probably just very boring, but just a healthy lifestyle. We eat the right stuff, exercise regularly, sleep properly. You know what your grandmother told you. But the fact is that remains the base of everything, right? So this is one important point. The other, quickly, I'll put that in, is that at a national level, there is fortunately a shift in policy towards health and wellness centers, again, as part of the PMJ, as part of the NHA, the National Health Authority. I happen to be on the governing council of that. But anyway, there's emphasis on health and wellness also. Now, so the way it's being sort of reconfigured now, with the somewhat greater grant coming in for the health sector, is that the primary health center should be reaching a stage where it can serve as a health and wellness center, right? And the rest of it should all be covered by different kinds of insurance or assurance schemes. Lots of new schemes are being floated. So I'm just talking of this in perspective that health and wellness is getting some importance. It will take some time for it to translate into reality. And, health and wellness also involves a lot of individual participation, a lot of messaging, many new techniques of communication, avoiding misinformation, which is our bane, and it's also a pandemic of misinformation. So I think those are important points that I would say, both in terms of the national scene as well as in terms of individuals, that a focus on our baseline health parameters, controlling non-communicable disease, controlling diabetes prevalence. It is already getting controlled in some Western countries, which initiated steps much earlier. Heart disease is going down in the US. Right. So the reason for that is that a lot of effort has been made. So if we make consistent efforts in messaging and providing options, or all very well to say, don't do this, don't do that, but where's the healthy food? I mean, how do people access it? Sometimes it's pure economics. There are a lot of things there. So I think that's the way we have to look. So this is a perspective that I would like to say is very, very important. And of course, when we go along, we can discuss, but a lot of role of greater health coverage via reasonable insurance schemes. That's very, very important. This has been brought out by the pandemic. I'll stop here, Smita, otherwise I can go on.
No, absolutely. And I think my apologies if my signal seems to be slightly acting up on occasions, but syndemic is a new word that I clearly have learned today and have been already enlightened with. But Dr. Nalini Saligram, coming to you, on this question of individual health today, before I talk about the broader health policy itself, what do you think were some of the key areas where individuals struggled during this pandemic? I know you have an entire team that has been working in India for the past 2 decades at the grassroots level. What would you say were the 3 key challenges for individuals in dealing with the pandemic during this period?
Right. Thank you, Smita, for including us. Yeah, I founded Arogya World 12 years ago. We work on non-communicable disease prevention, particularly diabetes prevention, Dr. Mittal, in the country through healthy living. I just want to add one sort of statistic to what Dr. Mittal already said, and that is that according to the World Health Organization, we don't need a new vaccine or a new technology to combat these non-communicable diseases. They are preventable largely. So 80% of type 2 diabetes, 80% of heart disease, and 40% of cancers can be prevented with 3 lifestyle changes, according to the WHO. You have to eat right, you have to exercise, and you have to avoid tobacco. So that prevention through healthy living is at the core of all the work that Arogya World does. And we work with school children and with people in workplaces, and we use social media, we use mobile technology to reach these messages to consumers. And the other, so what are the things that really people have struggled with? One is, mental health. That has become recognized increasingly as the biggest, probably long-term fallout from COVID. We have to tackle mental health. People have been isolated. People are anxious about their jobs, about, so many societal factors that even in a country like India, which has such strong social ties, we did a survey of how working Indians have coped with COVID. We asked them, how did you cope with working from home? By and large, and there's a WHO 5 index of 5 questions you have to ask them to understand their, everyone's mental well-being. So those 5 questions tell us that Indians, by and large, coped well, and it's because of the social ties. They're living at home, they've got family, everyone is still loved and feels secure, and there is a lot that has a lot to do. Also, managers reached out and said, how are you doing? How are you working from home? That engagement, that personal interest from your manager to you, that makes a big deal. People said, I'll give 100% of myself to my company. So those are very good indicators of employee engagement as well. So essentially, what I wanted to say is mental health but it is emerging. People need support. They need to join listening circles. They need to, get some support and help, because they're not alone. No one is alone in this. It has affected everybody. So anxiety levels have gone up. And much more serious mental health conditions also. So mental health is one, and we are tackling it in the workplace, as well as we have with NIMHANS developed stress reduction messages. We have supported Sangat, an NGO that's doing yeoman's work. So that's one. The other realization I had is, hey, eating right is so important, and unhealthy eating is the #1 reason people die in the world. The food you put into your mouth is the #1 risk factor for mortality, according to the Global Burden of Disease report. So if we can tackle food, we can tackle a lot. It's also important, healthy eating is important for being grounded, for resilience, for NCD prevention. 2/3, as I said, is because of unhealthy eating. So if we can fix all that and get people access to healthy food in their homes, and they're eating at home. So that's a good thing. They're cooking and eating at home more than before. So that's a good thing, but we need to do more of healthy eating, and of course, physical activity, which I'm sure Ramji will have a lot to say. Physical fitness is a very, very important part. Make time for yourself. So those are the things I would say, and want to pick up on frontline workers and other things later, but
Right.
at this moment, I'll stop.
I think those are great points, but unfortunately, these are also points that the pandemic exposed in terms of the inequality and the income divide that we are talking about. Even something like food and nutrition. Unfortunately, in from our capital, national capital territory to the major metros and other capital cities, we still do not have access even to clean water, to clean air. And add to it a virus as serious as COVID-19, and we saw what happened around us. Ramji Srinivasan, you somebody who's been training athletes and sports persons, and they're designed in a way where they have to be a fitness freaks, if I may use the word. But are you worried that somehow this pandemic has also pushed people maybe to an extreme edge, where people are overdoing it? Because 2 years you weren't able to go out there and practice. Even sports persons were practicing within bubbles. So this was a whole new experience for our entire sports persons itself. Where does one strike the balance in terms of this aspiration of wanting to live a healthier, fitter, and maybe a stereotype body type life as well?
Yeah, absolutely. Fantastic question, Smita, as usual. Thank you for having me here. And I think both the doctors stole some of my thunder, some of the points. But nevertheless, I'm happy, we are all on the same page. Yeah, coming back to athletes getting return to play. Basically, it's called return to play. During the last 2 years, it was extremely traumatic, both physically and mentally. For a sports person to be tied to a place and within a room, and it's a real like a what do you call solitary confinement. So it was extremely difficult on many aspects of it, because mentally and physically they were down due to various reasons, and they were not able to go out and perform. Second one is the monetary aspect of it. Third one, as you rightly said, some of them are not economically very well off to have certain type of food to even getting into the basic eating patterns. Fifth point, what I would like to emphasize is athletes getting too soon, too fast. They want to get back to the fitness and get back to the arena too soon. That can be an appetite for destruction. It has been an appetite for destruction. A lot of athletes, those who have collapsed and died on field due to various reasons. It's one of the main reason. I am sure both the doctors would endorse my point of view, is myocarditis. That has been a major case where athletes suddenly collapse on field. Even the fittest athletes, we don't know what is hitting them. And also depend on whether they have COVID, whether what's the level of syndrome they had, whether it's a mild or a moderate or severe COVID infected athletes, how they need to get back to return to play. There is a process and protocols one need to follow. And obviously, yeah, the bad hormones, stress hormones come into play when you are locked up in a room and you're not able to do anything. You have to fend for yourself, and suppose your entire family is also affected, then it's even more disastrous. So things have moved on, and guys have developed athletes have developed their own process and protocols in tandem with their respective support staff. So one of the major things which we need to look at is medical consultation. That is one of the key areas. When they have to return to play, they need to consult a doctor or a medical professional, where they are in a state of 1 to 10, and how. And also one point is, if every individual is different when they are affected by COVID, they react differently. So you have to take case by case, as a case by case, so that there is no stone unturned, rather than going by the books. So crucial thing is get medical attention, and depending on your ability to cope up and recover well is also genetically loaded, and how fit you are. Like, you should not have any. I'm sure most of the sports person don't have any of those problems, except for few athletes, those who have diabetic issues or hypertension issues due to various reasons. But over in general, athletes are more or less fit. And the big mistake, what they mostly do, is getting there too soon. Laws of diminishing return doesn't work here. So they have to be very mindful of the fact in following the process and protocols in place to the T, to perform better, to stay healthy first, mentally and physically. Then only all the other things come up. If you are mentally and physically down, rest of the things doesn't matter at all in any level. So we had quite a number of athletes, those who are affected by COVID, from moderate to severe. So we had to take certain precautions in every stages. We divided into 7 stages, how they have to return to play, and how they have to involve themselves in the physical fitness activity, proper eating, and some of them needed counseling also, psychological counseling, because they were down and out. So all the other support staff and professionals were involved in bringing the athletes out and bringing the best out of them. So it's a process in place, but we managed so far. I hope we manage better in the future, because this hit us like a hammer, sledgehammer, because none of them realized how it was, how everybody is going to cope up with that. So yeah, you have to follow the process. Very important is process and protocols need to be in place, whether it's a general fitness people or a sports fitness, even more, even for general fitness, all these boxes have to be ticked before they embark on anything physical, anything even related to nutrition aspect of it. One man's food is another man's poison. So it has to be individualized. It has to be taken into consideration. So that is my take on it, Smita, putting it in a nutshell, because as Dr. said, we can go on for a couple of hours regarding fitness, how to bring this aspect of it. Is it okay?
Yeah, there's some crackling.
Yes, some sound.
Smita ma'am, we cannot hear you actually, Smita ma'am.
There's something happening there.
Smita ma'am, your network is slightly, we can't hear you actually. Are you on mute?
It's crackling.
Still count. Still count.
Hi, am I audible?
Yes. Now it's fine. I think it was your earphones. It's fine.
Very sorry for it. Will now be able to do all the, live itself. Just you raised Srinivasan, so let me get in some questions because the issues itself. To individual health issues here, one audience as to what are the side effects taken after being affected by COVID severely. Would you like to answer this question?
I actually couldn't.
Yeah, it's not able to hear properly.
I couldn't hear you, Smita. I'm going to take off at random a little bit and make a few points so that we don't waste time. And meanwhile, you can check the audio again. One of the gains, and I take off on this point, which may be totally different from what you asked, which I couldn't hear, is the fact that Mr. Srinivasan made this point about following protocols, and also the fact that you have to consult doctors before you. So one of the other policy things that has potentially appeared after this, and some action has been taken on that, is the use of remote consultation and telemedicine. That's a huge area which was always there, but never really picked up, especially in India. And, in my kind of chronic care specialties, they're quite amenable. They lend themselves to these kind of consults much more than, let's say, someone who's having chest pain. There's a little difference there. So the issue here is that the pandemic taught us, even the skeptics and the most hesitant doctors, to use telemedicine in a much better way. Another focus of the government is to improve telemedicine facilities across the country. They're dependent on many things, including proper connections, as we can see now. But the fact is that is an area that showed us that it may be a model for the future, when you can reduce some visits. You can't obviously take them away. But for example, if someone is being treated for diabetes and thyroid, for example, again, you need not visit your doctor every 3 months. I'm talking of chronic patients. You can do a teleconsult every 2 to 3 months and maybe visit the doctor once a year for a full examination. There are pros and cons to that. But what I'm saying is it has shown that it's very doable. We need simple platforms. We need platforms that are accessible even and usable by the end user in remote parts of India. And we need them in multiple languages. That's very, very important. And also the fact that, there are these kinds of teleconsultations described, but one is the patient is directly conversing with the doctor. The other is, of course, that there's a doctor who's an intermediary, or a healthcare worker who's an intermediary. So if you're in a remote place, and if you're not well, a healthcare worker or a doctor can intervene and help you connect with the next level of medical care. So I think it is a golden opportunity for telemedicine to take off in a much bigger way in this country. Right now, it's fragmented. There are pieces, a lot of, in the health and wellness space is the most competitive right now. But I think now that the government is also talking about telemedicine as a priority, I do think that this is the time for us to develop standard policies, standard operating procedures, including, and I will throw this in here, including the legality of various advice, because there's a huge issue about that. If something goes wrong, if I advise someone on remotely about a certain thing without physically examining the patient, and something goes wrong, who's responsible? So I think that's a very, very important point, that telemedicine regulation, facilitation, and making it easy and accessible is a very, very important area that we have learned from the pandemic and should be incorporated in policy, as some attempt is being made in that direction as soon as possible. And I think that will improve access to doctors. It'll reduce crowds perhaps in OPD a little bit, in outpatients, and it'll just save a lot of money for people who are traveling 1,000 miles to see their doctor for a minor thing sometimes. So and again, doctor to doctor, the availability of a specialist can help a doctor at the periphery decide this person needs to go to a hospital immediately, and like that kind of thing, needs an angioplasty, needs whatever. So those kind of structural things are one of the major, I would say, gains or potential gains of the pandemic. The fact that we could do this.
So, Smita, we can't hear
Thank you
you
for
again.
answering that question Dr. Mittal Afzal had put forward, and my sincerest apologies for all the technical glitches on my side. It shouldn't have happened with a broadcast journalist, but unfortunately it did with the Wi-Fi connection. And in fact, I will go back to asking you the question that I originally asked Dr. Mittal, but before that, Dr. Nalini Saligram, just as a follow-up to Afzal's question on telemedicine, during the pandemic, do you think, especially in terms of, yes, we know that when it comes to teleconsultations with big private chains of hospitals, they more or less work. They work fine. You're paying a fees. They work. They insure. They give you personal calls to ensure that the call goes through. For the government sector, telemedicine consultations that have been launched, states, centers on different sectors, what has been the feedback like for people who have been working with them?
Right. So I do want to tell you a little bit about our use of technology, not quite telemedicine, but I'll try and answer your point. We have been watching this 104 health helplines, and they have gone up quite a bit. So I know that people are calling to ask about COVID, these various health helplines, and they are getting a lot of responses on other fields as well. So if that is an indication, then there is an uptick in the use of tele consultations of some kind. But I did want to pick up on, civil society has run with technology in the last 2 years. You've seen so much use of technology. Mobile technology is something, as well as digitization. So we ourselves digitized our schools programs because schools were closed. We digitized them and made them accessible on government portals to school children, and we're rolling it out in school children in Goa with the government's partnership with the government, and in other places as well. So evolving to hybrid models and evolving to the use of technology and digitization has happened in a very, in very exciting ways. Some of those are going to stay forever. These kind of Zoom calls and webinars, this is now the way of life for all of us. The other thing I want to say is, we have always had a mobile technology platform. That is the first program we did. We call it M-Diabetes. We send text messages twice a week on diabetes prevention to people on their phones. Why is this mobile technology so important? It is near ubiquitous. 1 billion people in India use their cell phones. So for sure, it is a very powerful public health intervention tool. And it is a population level. See, when in policy, you always look for population level effectiveness, right? Not good enough to show a pilot. It works with 100 people in this setting in a randomized controlled trial. But you have to follow up like this for 4 years, and then you'll get outcome data that is so great. A1C reduces. And But hey, in the real world, you have to reach people from North India, South India, who eat vegetarian and non-vegetarian food, and you have to appeal to all of them. So population level, mobile technology is a very good one. So we've had, and we've shown effectiveness. So there was a question on how effective things are. Well, we have shown, we worked with Nokia to send text messages on diabetes prevention to 1 million Indians, and we showed effectiveness. And this effectiveness is now 20% improvement in multiple health behaviors that are known to prevent diabetes. So we showed eating 2 to 3 vegetables a day, 2 to 3 fruits a day, avoiding fried food, and moderately exercising. So all of this is there. We have papers. We worked with partners, and it's all being validated with Stanford Care. The digitization of our schools program also, we're very happy, is showing effectiveness. In the non-digital world, our schools program has shown 11-year-old children are understanding the importance of healthy habits and are changing behavior, even if it is self-reported that we have done. So 15% impact. So, hey, you have science-based programs, well-designed programs, you deploy them with some thought. Civil society can be a major partner to government, to workplaces. We can go to the last mile and really deploy and get to the grassroots. It's very exciting to see these big coalitions. I think the best thing that's happened is I get a front row seat to watch the changes and the exciting changes in India's development. And we are learning from.
As long as, I think the basic question to keep in mind here is, as long as we are able to bridge the digital haves and the have-nots gaps and the inequity too, so that it is accessible. Dr. Mittal, I just wanted to repeat the question from one of our audiences for you, which is, what are the side effects of medication, antibiotics taken after having tested positive, after being affected by COVID seriously? We were all shooting in the dark for the majority period of COVID, from remdesivir, ivermectin, all kinds of names that were doing the rounds. Sure. We had all become doctors ourselves, Google quack doctors. So if you could throw some light on that.
So firstly, let me just put it in perspective. We've always been our own doctors. So the COVID just brought it to the fore. Indians trust their chemist more than the doctor many times. So I think we tend to self-prescribe, and although there is more regulation now, easy availability and easy access to even dangerous medication is a big question mark, especially in smaller towns and other parts of India. So I think that is one. Secondly, unfortunately, COVID, especially 2020, doctors knew very little about it. So a lot of people were shooting in the dark, and that included doctors. But everyone was hit by the virus, and no one knew, what's going to happen. Therefore, all these treatments came about. But by the time the second wave hit us, we had pretty good data. What is inexplicable to me is the misprescribing in the second wave, the lethal Delta wave. And I think that really is a serious concern. Hopefully, there will be no long-term side effects of anything, but certainly we went overboard in our prescriptions. There is no questions. Azithromycin was being used like chocolate, and there is absolutely no evidence that azithromycin or any antibiotic does anything for any viral infection. And that we knew from earlier. So there was no reason to think, but it still was part of everything. Hydroxychloroquine, ivermectin, okay, for 2020 were used, when the data came clearly that they don't work. A lot of people used, and people fight with you on social media platforms about ivermectin, saying that you want to promote drugs that are expensive. See, what do we do for viral fever at home? If someone gets viral fever at home, COVID-19 is a viral fever, a viral infection. Okay, what do? We say you take paracetamol, you take hydration. If you get sneezing and all, take an anti-allergic kind of thing. That's all. So using drugs to treat a viral infection is a paradox in itself. There are very few viral infections that actually respond to drugs. Later on, we discovered some drugs, which are effective. We discovered monoclonal antibodies, which are effective. So all those things were fantastic discoveries. But there was a lot of unwarranted, unnecessary use of medication, particularly, I would say, in both the rounds, first and second, but particularly in the second, because by second wave, when the second wave came, we were aware. So clearly there could be long-term side effects. I'm not saying that, but we don't really expect, going by the history or the knowledge about these medications, and I've left one medicine out, which I'll speak in the end, talking of antibiotics or ivermectin or hydroxychloroquine, you probably won't have any long-term impact. But we also misused steroids a bit.
Right.
Quite a bit. I'm being very cautious. I mean, it's actually quite a bit. So steroid misuse, and we use steroids for very long periods in some patients. I don't understand why. And therefore, steroids were life-saving in COVID if used in the right patient. That's important. But they were used ad libitum, anywhere. So I think that certainly could have a long-term impact on bones and muscles and, so many parts of the body. Some of those things will have to be worked on in terms of taking people like Srinivasan, taking their help to get yourself back in shape. Otherwise, your bones and muscles will definitely be impacted by long-term steroid use.
But before I go to Srinivasan, actually with that question, just to follow up quickly, Dr. Bittal, I mean, then as we are emerging out of the pandemic, has there been any better streamlining today of the medical fraternity itself, or where in future, if this kind of a situation emerges, at least there should be some sort of a consensus of, because there seemed to be a delay in information that was coming in from ICMR about the use or misuse of medicines. Would you be hopeful of a better streamlining of information now?
I think the misuse of medication in the Omicron wave was much, much less. Okay. And let me tell you, much of the misuse arises not from just lack of information. It arises from fear on part of the doctor. You are scared that this patient's oxygen might drop, something might happen. He's 90 years old, although he's fine. You will pump him with medication, not knowing you're doing more harm sometimes than good. So it comes from a genuine concern for patients sometimes that people tend to over-medicate when they're not sure. But I completely agree. And that's one of the points I had just jotted down as I was driving back, that I must make this point, that standard medical treatment protocols are exceedingly important. And yes, the ICMR is also struggling in its own way to keep updating them, and so much new information was coming in. But the fact is that the impact was much more when doctors, KOLs, as we call them, key opinion leaders, had large webinars and conferences, and the message got disseminated from experts in the field that this is what you do, this is what you don't do. I think that is important. There is no doubt that we should be following protocols. You see, unfortunately, Smita, Indians don't really like process. We like to be little random, that we know the best, we can tell you. And there are so many studies to show that if you follow strict processes, you will reduce your load, increase your efficiency, and use your brain for better stuff. But unfortunately, it's only now, at least I'm talking of doctors, maybe it's very different in the IT industry or whatever, but people are not used to following a protocol because of the protocol, but I know best for my patient, what is the best. But I'm hoping that at least with regard to pandemics like COVID, there will be a significant change. There is definitely a significant change in understanding. And I will not take away from the doctors who consistently messaged colleagues over WhatsApp, over this thing with the right information, over all the correct platforms. And ultimately, you have to realize these guys are doing this. There must be something wrong in what I'm doing. So yes, protocols have to be there and should be insisted upon.
I mean, that also stems from whether there is enough self-introspection happening within the medical fraternity or not. And I think Indians, we just love rash driving, and lane driving is something that doesn't come easy to us. So nobody wants to stick to a lane. And that was a larger reflection perhaps during the times. Ramji Srinivasan, coming to you, in these questions, and you spoke about sports persons, how they reacted to the pandemic. But for ordinary young men, women. Today, we've seen such an uptick in cases of public figures, celebrities in their 30s and 40s dying of heart attack, cardiac arrest, stroke. What would you say, how would you define fitness? How should people define fitness? And this problem of an entire Google generation that is also overdosing on multivitamins, on protein shakes, on all kinds of concoctions. Your word of advice for them?
Oh, absolutely, Smita. You hit the nail on the head. And doctor literally ripped it apart. as he rightly said, nobody likes to follow process and protocols. Everybody want a shortcut to success. There is no shortcut to success at all. So yeah, coming from the sports person and which is percolating down to general fitness people, for me, the definition of fitness is ability of an individual basically to harness his or her potentialities, be it social, be it psychological, be it physical, to maximum, to harness it to the maximum. So it may vary from ratios to ratios, depending on what they are looking out for, where they are in a scale of what ratios. So it depends from person to person. So all 5 fingers are not same. What we do is cut and paste workouts, cut and paste nutrition, cut and paste exercise protocols, or any sort of treatments. Like the doctor said, everybody is an expert giving paracetamol or steroid. But that's still happening in our industry. Imagine medical industry, it's happening. It's really shocking in our field, strength and conditioning field, because there is no system in place. There is no process in place. It's literally a shocker, to be very honest about it. And what an individual need to do is consult before embarking, whether they are affected by COVID or not. They need to follow certain process and protocols in place in identifying where they stand physically first. Whether they have any medical conditions, they need to get the medical examination first before embarking on any fitness aspect of it, because we see the end product of these social medias, 6-pack, 8-pack, bulging biceps or pectorals. These are all, you don't know how they got it. We see the end product. So we get carried away, by advertisements or social media or the movies. We always get carried away by the larger picture rather than looking at the problem aspect of it. So every individual need to consult a doctor before embarking on any level of fitness, whether it's intense work or a normal work or a yoga or any sort of sports or combat fitness, any level, they need to consult a doctor, because the world is such now. You don't know who's got what. Because of a lot of other things are also cropping up, like lifestyles have changed, the food eating habits have changed, and the way we live has changed. So the work, what we do has changed. So everything has changed. We cannot pick up what we had pre-independence time. When I was young in 1922, I did this. This sort of cock and bull story doesn't apply now. You have to go with the time and adapt yourself. Adaptation is the key word. How they adapt themselves to the current situation and look at long-term, mid-term, and short-term goals. Set up goals. Not only for a sports person, even for individual, set up small, mid-term, and long-term goals and work towards every level. Unless and until you set up goals, you won't follow the process and protocols, for sure, because there is no professionalism involved. So you have to be professional, because it's your body, it's your mind. End of the day, you are the sufferer. I know a couple of sports person. I don't want to name them. I know a couple of movie stars, those who had serious issues on their kidney and liver, taking supplements and steroid. They want to look good. They want to show that they're transformed from being obese to being ripped in 3 months, 6 months time. Then all of them should go to Olympics and participate. It really angers me when athletes are struggling for 8-10 hours a day and they're not able to reach there. These guys are in 3 months. It sends a very wrong message to the public. Everybody wants to be there short. Who doesn't want to be a multimillionaire in 2 months' time? Everybody wants.
But there are no shortcuts. And as you rightly said, that adaptation needs a long-term plan, a mid-term plan, and to be able to follow that plan in a disciplined fashion.
To the team.
That's important. Dr. Nalini, there's a question for you from our audience. Somebody wants to ask as to what and how is the space for emerging healthcare startups in India as well as in the global market?
It's actually very exciting. It's very exciting to see the startup world in India. It's being invested in. It's wonderful to watch the whole system, and even picking up on the topics that we are talking about, which is non-communicable disease prevention, as well as eating right and exercise. These are all. There's a lot of startups in this space as well, that are really making strides. So both from a funding perspective and from an ideas perspective, India is leading the way in this innovation. It's exciting to watch. I do want to say two things, picking up again on what others have said. In terms of fitness, what we offer to working employees in our what we call healthy workplaces is a lifestyle change class, a training for ordinary employees to become coaches. And we bring this, it's very moderate exercise, Ramji. We're talking about 30 minutes of exercise.
30 minutes
a
of
day,
exercise is
and
more than sufficient. It has been proven.
Yeah, and it's what we say is for 30 minutes of moderate activity, physical activity, not quite exercise, but that's enough to keep these diseases at bay. Absolutely. And if you walk, what I personally follow is 50,000 steps a week. It's much easier for me to think in terms of 50,000 steps a week instead of 10 or 15,000 steps a day. That's harder for me than I make it up in the week. But I did want to say that lifestyle coach training is something we offer, and we bring this from the Centers for Disease Control in the United States to healthy workplaces, and that is great. The other thing I want to pick up on is healthy eating, and we believe very much in balanced meals. And we promote something called My Thali, which shows in a picture form exactly how much dal and how much rice and how many vegetables you must eat. It's cooked quantities of rice. It's not hypothetical. It's not grams, 9 times 30 grams of cereals and millets must be eaten per day by a woman. Yeah, that's the prescription, but that's not understood. So we translate it to 1.5 cups of cooked rice, 1.5 chapatis, whatever it is, that for a woman first, because we think a woman can educate the rest of her family and steer them towards healthy living. So a balanced meal in the right quantities, learn what to eat and in what quantities at every meal. And that, I think, so it's a very common sense approach to eating, and we follow the US My Plate approach. As you can see, we bring a lot of this US India stuff into our thinking, picking up on good ideas everywhere. We don't have to reinvent the wheel. So I did want to say that there are everyday things that you can follow.
Absolutely. Dr. Mittal, coming back to that issue where you said that a lot of the doctors are also prescribing out of fear. We did see the Epidemic Act amendment happen last year during the COVID wave, where stricter legal provisions were made for any assault on doctors by families, or both in terms of fines or also being put in behind the prison. Has that worked? What is the feedback like from the medical community, and what can really safeguard and assure doctors to work in a way where they act without the pressure of the patients who are coming in?
I think it's a complex issue, Smita. It's not going to change that easily. I doubt it if there's any significant change right now. There are certain levels of interaction. Like if there's violence, that has to be punished like immediately. I don't think there's any confusion about that. And it still happens. Violence against doctors is not, which is the other country in the world which sees a lot of violence against doctors? That is China. When economies change, countries grow, expectations change. The role changes. Doctor was always on a pedestal and someone who was just, like solving problems. That role has changed in the patient's mind. They expect certain services. The expectation has gone up. And sometimes the facilities or the skills may not match up, largely the former. The doctor may not be able to provide the kind of care that is required. That is number one. Number two, expectations may be completely unrealistic because of lack of awareness. You see, this is a problem because the population large segments of population are unaware about the little nuances of healthcare and what outcomes to expect. And so there is a challenge it's not an easy question. I mean, it's not an easy answer to give, because there are multiple angles. I think in a general sense, one of the things that makes a huge difference to this is communication. Where doctors can correct themselves is in better communication with the patient. Unfortunately, nowadays, especially in the larger cities, and you have to also record that communication because it just gets lost. You may have been so empathetic to your patient, may have spent an hour, but where's the record for that? You can't prove anything. So anyway, having said that, if doctors sometimes give more emphasis to communication, and even in case of bad outcomes, take it on the chest, talk to the patient directly, that really reduces. Multiple studies have shown that reduces the litigation in the US or violence and other actions in India. So that is a challenge. But yes, overall, it's not an easy thing to resolve in our society. It will be a challenge. I don't think there's any difference by any legislation as yet.
But also the other big question today, sir, of resources itself, because human resources.
Yes.
I mean, during COVID, during pandemic, while there was a lot of attempt in trying to overnight build hospitals, infrastructure, COVID specialty beds, you may build a bed, you may bring in oxygen cylinders, but where is your medical staff going to come in? You can't train them overnight. What would your thoughts be, as we are reaching the end of this conversation, on what does a country like India need to do at this point to address this big issue and this big gap?
I think, fortunately, again, there is some emphasis in this area now. There is no doubt that there is an acute shortage of medical personnel, healthcare workers, not just doctors, but I would say even more of nursing staff and other paramedical staff who are critical, who are more important sometimes than doctors in saving lives and with their presence in the ward all the time or whatever. So I think that obviously we need more people to be trained, but it's easy to say that. It's also relatively easier, and the huge push has been given to developing or opening more medical schools across the country. That's a stated goal, and that's fantastic. But there's a caveat there. The problem that I foresee, and I'm sure people are working on that, right? The fact that where will you get the teachers? It is not okay to say that every doctor can also be a teacher for an MBBS course. I think there is a challenge. There are doctors who are teachers. There are some who are not teachers. And therefore, there has to be a model where doctors, when they join, say, government service or any service, are given the option, I will devote 20% time to my teaching or 50% to my teaching, as they do in the West, so that it is a commitment. And should not affect their emoluments. That's another thing. So you have to cushion them, because their generation of revenue, if it's a semi-private or private institution, will be less if you're giving time to teaching. So you need to work on those models where it's not that you just put people with the doctor, put students with the doctor, and they will all turn out to be doctors. Teaching is a lot of effort. Not everyone is cut out for it. And unless you have good teachers to back up this huge initiative that is quite remarkable of increasing the medical colleges, that is even the All India Institute of Medical Sciences, so many campuses are. But to maintain quality and train good people, you need people. So I think that has to be the focus as far as I'm concerned. But there's one more aspect. That is, in India, the inequitable distribution of medical care or medical care workers. And that's not, again, going to be easy to solve, because you can't force it. Sometimes you think you can force this. Some of it can be forced a little bit. Some of it has to be encouraged. Some has to be incentivized. There have to be ways. You can't, the thing is that even if you produce a lot more doctors, they will still gravitate to the cities. I mean, wouldn't you? People talk of it like very differently. Why are we sitting in Delhi, Bombay, and wherever? The fact is, the truth is that there are more amenities, there are more facilities, there is better education for our children, there are better prospects. So people tend to gravitate to middle size or larger cities.
But in the context of the medical care, Dr. Mittal, I mean, one would believe that, we have heard announcements of AIMS coming up in places.
Yes.
Some of those announcements never really take off. But if these AIMS were built with the competence that we see in the AIMS in Delhi, the patients would love to be closer to their home, coming to Delhi, sitting on the pavement,
Absolutely.
days and night after night waiting for one appointment. Forget even the surgery. Uh, why wouldn't people want to do that?
So I think that's the idea, and it takes time. And I definitely know that there are some aims that have taken off pretty well, and they are seeing huge number of patients. Even the aims in Gorakhpur, which I'm involved with as a mentor or whatever, is it's barely started, but it's overflowing with patients. So, but there's a long. It's these things, these institutions can't be built in a day. It will take a lot of time, a lot of inputs, good faculty. And fortunately, I think the funding position looks for the institutions themselves does not look pathetic right now. It looks good actually. So probably we should be able to circumvent that, but it's a big challenge. It's not easy.
Okay, so that's good to and assuring to hear, despite, of course, the kind of health budget cuts that we saw in the numbers that were projected. And when you actually studied them in reality, you realize that the budget had declined substantively. And just for, all our participants and viewers, in fact, Amrish Mittal also happens to be on the governing council of the National Health Authority. So I'm sure that all these great suggestions are being looked into and heard about. Ramji Srinivasan, there's a particular specific question for you. Somebody wants to know that if someone was affected by COVID, whether it was mild or serious, which affected their immunity, and they worked on the immunity, but what is the fitness advice you would give to them to strengthen their core, to keep their immunity game strong?
Okay, it's a small question, but the answer is huge. But I'll try to keep it as short as possible. Okay, first of all, let's assume that all the protocols are taken care of. All the boxes are ticked. So one need to take things very slowly. He or she is affected. There are 7 stages. At every stage, start off very slowly and then progress to the next level. At every level, consult a doctor. Very, very important. At least don't start anything within 10 days. You need 10 days of basic gap after you are affected by COVID. Then you start out with a very, very mild exercise so that there are other symptoms like your breathlessness, soreness, all those things are taken care of. Then you progress to the next level, and finally end up doing what you've been working on. So that's why you need to set a small micro goals on everyday aspect of it. Monitor your heart rate. It's called perceived rate of perceived exertion, RPEs. So work on the RPE aspect of it so that your recovery process is also very important, like your sleeping and the nutrition, what you eat, very, very critical for your recovery protocols. And the sleep is highly underestimated, undervalued thing in recovery and for wellness of an individual, because it becomes a fashion to say that I sleep only 2 hours, 3 hours in the day and finally end up clutching his or her chest, getting a heart attack or any sort of stroke and other things. Sleep is as important as exercising. So embark on good recovery, good workout progression, good diet, and good relaxation. They bring in the happy hormones, like not the hardcore ones. Bring in happy hormones into place so that all the aspects of mental well-being and the physical well-being are taken care of. And again, it is all individual. Never follow a protocol what is in Instagrams or social media, etc., because we are all made different, like a thumb impression. We need to address individually those parameters into place to bring in the best out of you. So it's a long term and have a goal. End of the day, we need to have a goal.
Just a quick follow-up from another audience, and I'm just going to ask the last questions now to all of you. So for Ramji, somebody wants to ask that most of the fitness coaches in India actually have no educational background in fitness. It has mushroomed as an industry.
Yes.
Just like we have seen the coaching industry for education, the fitness industry, the lifestyle industry has actually mushroomed, and there are still actually very little accredited courses to kind of filter through what is genuine and what is not. Yes. So, what should perhaps be the government's take or policy? Is there something where it should step in and see that the genuine instructors are there to help people and not the ones who are spreading quackery?
Absolutely. That's very important because it is under organized field. physios are organized, doctor, like how the doctors are organized, physios are organized like quasi doctors. There is nothing for strength and conditioning guys or a physical education experts. Government should bring in a policy. They need to have certain
post-COVID recovery. One of the tools, really important one, is healthy living. The more I think about it, the more I reflect on it, I really believe healthy living and piggybacking on the frontline workers, piggybacking on everything else that's already happening is very important. And I wish the government would support everybody and anybody who wants to take prevention to people.
Right. And I think also, the entire the situation of something, a backbone like the ASHA workers itself is a matter of great concern today. Unfortunately, they are not on the payrolls. They're not taking home the financial kind of support and security net that they should be a part of today for all the services that they perform. That's another area that we need to keep in mind. Dr. Amrish Mittal, final word from you. Somebody actually asked a question related to insurance also, as to why can't direct tie-ups happen, where you can prescribe directly, tie up with health insurance, amount covered directly. Not sure I get the question, but we've seen a PM Ayushman Bharat, project being rolled out, health insurance is being given. But what do you see as the critical gaps that need to be filled today, taking in perspective the lessons from the pandemic in particular and the new diseases that we are talking about today?
So I'll answer this, Smita, quickly in two parts. Number one is the overall concept, and I think the overall concept should at least, where private insurance is available and ideally in government insurance also, start paying for primary care, for chronic disease. It is crazy that my patients with diabetes are unable to get insured, but they are able to get, reimbursements for their kidney transplants and coronary bypass surgeries, not for their diabetes medicines or blood pressure medicines. So that's strange. There is a gap there, and I suspect it's because companies are wary of a lot of misuse. But if we were ensuring chronic care better, preventive care better, we would save a lot of money on these tertiary care procedures. So that's number one. Now, this has moved on the premise that primary care is available to everybody, which, as you know, is not necessarily true. But the fact is that we should look at that. That is one aspect. Having said that, in terms of the NHA and others, there is definitely a huge attempt to increase the coverage. Of course, the Ayushman Bharat has been in place for a couple of years now, but now they're really expanding their coverage. And there are 2-3 things they're doing. Number one, they have revised their packages. They've made them a little bit more realistic. Times change, years, and therefore I think they will probably be more acceptable to a lot of hospitals now. That's number one, although they already have a lot of hospitals, especially in the periphery, on board. That is number one. Number two is they are strongly encouraging group insurance. So they will negotiate on, supposing it's, a company that you work for that has 10,000 employees. Now, you can go through the Ayushman Bharat. They will have a portal for this, they tell me, where all these things will be available. What are the rates? What are for this number of people, that number of people, like that. So that if there is some standardization of premiums and rationalization of costing, will have a big impact. And I think this overall concept, so one important group that they are looking at right now in terms of policy is a group that is not like the below poverty line group and not the upper middle, like the lower sort of low mid segment, which sells their valuables to cover for healthcare. That's a huge group where they're not aware enough to be insured properly, but they are not like below poverty line. They are aware, but they don't have the wherewithal. So such people are being covered in this group, again, for a 5 lakh sort of coverage. So I think there is an attempt. Now we'll have to see on the ground how this translates. But even forget the government policy. The idea is that companies that offer insurance must extend their coverage. They can have a lot of checks and balances in place to cover chronic disease and not just catastrophes that happen.
And also the elderly with comorbidities, it's become a very difficult category to get insurance, and more so at a time when the pandemic has actually forced so much of job losses. Most of the jobs today are in unorganized sectors. So these necessarily do not have the advantage of having a group insurance plan in place. So for these individuals to take care of their elderlies with comorbidities,
Yes,
finding an insurance
absolutely.
package is next to impossible today.
Absolutely, I agree with you. And I think that this requires a lot of effort and a lot of work, a lot of financial planning, so that it's viable for the people who venture into it, but at least in the private sector. And of course, the government, I think, whatever I can sense, is making effort to enhance insurance coverage. Because remember, one of the concepts there is that all healthcare, despite all effort, and we all like to sound noble and say that everything should be in public sector, which it should, but it's not going to happen overnight, right? More than 2/3 of care is provided still by the private sector in this country, and it's not going to change overnight. So it's important to understand that if we have reasonable insurance policies and regulation on the private sectors, the hospitals who violate norms, that also is coming, not like knee-jerk reactions and then nothing. Some structured, acceptable regulation, then we'll be able to provide care to a lot of people. So you cannot do it just at the moment, just with the government sector. That was always free. Right. The government sector care, but we weren't able to cope up. So therefore, this is important. And as you said, more and more hospitals. But ultimately, last sentence, that primary care is the most important.
Yes.
And unless we cover that, we'll not be able to reach.
Dr. Mittal, please make those health and wellness centers think about prevention, non-communicable disease prevention, please.
Whatever I can do, yes.
On appeal.
Right. I'm glad that, there are, of course, a good exchange of notes here. A final word, Ramji, I'll give it to you, because there's somebody called Barkham Dikshika, who's very worried that even after exercising every day, I haven't reached fitness level. What might be the issue?
I can empathize with that.
What's the golden mantra to fitness? I mean,
there is no, to be on the lighter note, to eat, drink, and be merry, be happy, not drink literally, drink some juice, drink some healthy food. The thing is, as I told earlier, you need to test yourself where you stand in a scale of 1 to 10 in fitness. What aspect of fitness you are lacking, whether it's aerobic fitness, whether it's a core strength and stability, or your agility, or your balance, or your stability, or your strength. You need to test that first. Without doing the assessment, it's very difficult to give you a workout schedule and tell you what you need to do. I can rant off something, do this, do that, but after this show, you will think, look at that man, he's told something which is totally wrong. You should know. No, you need to test yourself. Physical fitness test is very important. You will know exactly where you stand and what are the ratios of fitness component you need to improve on, or your flexibility, or your aerobic fitness, which is lacking. Because of that, you're not losing weight, or if your strength component is bad, you're not able to put on muscle and reduce the fat. So there are, or your balance and stability, which you're not able to do the other activities. There are a lot of other things, nuances, which you need to look into before embarking on a fitness schedule, because very difficult to.
Absolutely. I mean, every individual, in fact, would have a different fitness goal, different definition. And really, I think my word of caution would be, there is no one size that fits all. So for me, my fitness would be about being able to get a good night's sleep, even if it's for 5 hours, but to have a sound sleep. And that is something that remains elusive on most days. So, but, thank you so much, Dr. Nalini Saligram, Ramji Srinivasan, Dr. Amrish Mittal, for joining us in this conversation. I'm sure people have a lot more questions, but we just tried to integrate a bit the individual health issues into the public policy spectrum, because at the heart of the public health policies is the individual at the end of the day. And if anything this pandemic has taught us, it is that there is nothing more valuable than our health. So I think we all can be critical so much of our own bodies on most days, but for those of us who have survived this pandemic, there is a lot to be grateful for. And hopefully the governments and the authorities who otherwise have a lot of time for polarizing debates will continue to focus on areas where the focus actually needs to be, to ensure that we have healthy generations today, tomorrow, in the years to come. So thank you so much for each of you. We will continue with the Let's Talk Policy series from Kautilya. policy dialogue. And that's all that we have
Thank
time
you so
for.
much.
Thanks for watching.
Thank you so much, Smita. Thank you, doctors. Both the doctors learned a lot from you all.
Thank you
Thank you so
very
much.
much. It was a fascinating discussion. Enjoyed
Thank
it
you so
thoroughly.
much. Good
Thanks.
day.
Thanks so much.
Thanks, everyone.